Do you have low back pain? Maybe it's low back pain in the center of your low back. Maybe it's off to one side or the other. Maybe it goes down into your hip or hamstring, or maybe even go all the way down to your foot. Hi, I'm Dr. Ian Puntney from Wellington Chiropractic, and today I'm talking about low back pain. What I'm going to do is give you some possible causes, some exercises to help if you have it, and then ways to keep your spine healthier throughout the day. So when we talk about low back pain, the first thing to realize is it's very common. About 38% of the population is going to have it in any given month, and they found that 40 to 80% of people are going to have it at some point in their life. So most of us are going to have bouts of low back pain that we have to deal with. When it comes to low back pain and causes, they've done some studies to evaluate that, and what they found is we tend to move our spine in one direction a lot more than we move our spine in the other direction. And what I mean by that is they've done studies that showed monitored spinal positions in people. And what they found is we spend a lot of time rounded forward and very little time in extension or going backwards. So how much time do we round forward throughout the day? Well, we do it when we sit, when we tie our shoes, when we bend over to do the dishes or pick something up. They found that on average, people spend around 4.9 hours a day flexing their spine, okay? How much do we extend it? How many activities do we do where we're extended? Well, they found that we're in extension 24 minutes a day. So 4.9 hours in flexion, 24 minutes in extension. That's very lopsided. They've done other studies with people that have low back pain and no back pain. And they found that the people with low back pain reported being in flexion more often than the people without low back pain. They also found that people without low back pain reported being in extension more than the people that had low back pain. So what can we take from that? Maybe we just need to baseline, get more extension in throughout the day. So like I said, flexion is very common, and the odds of you avoiding, doing all these flexion movements is very little. The one thing I can give you is if you are somebody that sits a lot, get a lumbar support, prop your low back forward so you get some extension while you're sitting. Sitting's, the number one thing that typically flexes us throughout the day because we sit so much, but it's hard to avoid. So yes, you can work on your lumbar roll in your chair, but what can you do knowing that we're going to flex a lot? Well, proactively just do some extension exercises. So whether you're having low back pain or not, extension's an easy thing to do. You just stand up out of your chair, hook into your low back, feet spread, shoulder width apart, weight on your heels, and drive your hips forward. So I'm just extending my low back, and I go as far as I can. What I do, whether I'm having low back pain, is I do this every couple hours, 10 to 15 times. You're not going to hurt yourself, and it's actually usually really good for your low back. Just to kind of remember, 24 minutes versus 4.9 hours. We've got to balance that out a little bit. So I would suggest just throwing some extension in there throughout the day to keep your spine healthy. If you're having low back pain, you can also try this, and a lot of times your low back pain will go away if extension is what your low back needs. So if you're having low back pain here, or maybe it's even in your hamstring, grab a hold again, 10 to 15 as far as you can go. And then monitor your symptoms from when you first did the exercise to when you quit. And if your pain maybe goes from your hip and now it's just right here, and maybe it's a little worse in your back, that's okay. But the fact that it moved from here to here is actually a great sign, and the area where it hurts is getting smaller. That's called centralization. That's what we want. That's good news for your low back pain because you can self-manage it at home with extension exercises. So if you're if you have low back pain, you can do those every hour, 10 to 15 reps. What you want to avoid is if it makes it way worse or it makes your symptoms travel away from your spine. The more I extend, the further it shoots down my leg. Stop doing an extension, you need a different direction. But this is something you can do at home. It's generally safe. You're not going to hurt yourself doing extension exercises, and it's something you can just add in daily to kind of counteract. Again, I'm emphasizing 4.9 hours in flexion, 24 minutes in extension. Let's get some more extension in our spines, and you might just have less low back pain. So remember, extension, support your low back whenever you're sitting, get up every couple hours, do some back bends, get your whole family doing it, get your coworkers doing it. Let's get everybody's low backs better. All right? I hope it helps, and I'll talk to you soon.